Afternoon, everybody. Hope you're still awake after that marvellous lunch. Integrated radiological services might be a bit of a mouthful. We often talk about IRS, but that does other things to people because they immediately think we're in some way related to the Internal Revenue Service of the United States, and we have no connection with that organisation at all. So I'd just like to reiterate what some of the other speakers have said. It's great to get the opportunity just to present some of the things that we do and some of the issues that on innovation and relationship management that we think are key, both to us and to the NHS as well. I'll try not to waffle on too much because I have a tendency and I know that. So in order to try and keep the time and not delay the wedding, I shall move on a bit. Bit of background. Who are we, of course? Well, we're the largest independent provider of radiation protection medical physics support services in the UK. We have a legally required advisory function to provide to the NHS or to anybody that uses radiation. It's part of their workload. Our key partners within this are our NHS trusts, but we also provide similar services to the independent sector, veterinary, dental practice, outside of healthcare, including light industry, utilities, construction. And actually, this is quite interesting for us because it's a bit of a new venture. We're traditionally from a healthcare background, but it actually provides us with an opportunity to think of new ways of delivering medical physics support and scientific support within our NHS organisations as well. Innovation is not new to us. Innovative entrepreneurship is the expression up there. We used to be an NHS medical physics organisation until 1988. But then with the help of the local NHS, the Strategic Health Authority as it was then, and the Regional Scientific Officer, and also with the help of the national programme for outsourcing, can we use that expression, within the NHS, we became a private organisation. We developed training programmes for radiographers, medical physicists working within the NHS, and we're the first people to do that, and we provide the longest running training programmes within the UK. So we have a breadth of experience of lecturers, trainers, presenters, and that's also allowed us to take our skills and experiences and transfer them into Europe as well. So we've been involved with the European Commission on training programmes for medical physicists and radiographers as well. And we have active roles within external bodies, the universities, the professional organisation for physics and radiology, Institute of Physics and Engineering and Medicine, College of Radiographers and so on. But also from a training and actually a provision of service innovation, we actually started to look at innovative provision of test equipment, hardware to allow diagnostic radiology to carry out its legal requirement for quality control and quality assurance. So over the 30 years nearly, we're actually established at the heart of the NHS in what we do, and these are just some of the organisations, NHS organisations that we are working with in here. Obviously I can't put them all on, otherwise you wouldn't be able to see anything on the slide. So our service summary then is, as I say, professional consultancy and scientific and technical support. So this is uses of ionising and non-ionising radiation. I'm not going to go on about physics and medical physics because it's probably hard enough to stay awake after lunch anyway. But oops, what have I done? Have I turned it off? Oh, that's better. Okay. But also training, both from our internal training, but also training for NHS employees who are working with radiation, diagnostic radiographers, for example. And we provide that level of scientific and technical support whereby we make sure that the X-ray equipment is compliant, working to standard, and so on. But also research and development. Research and development is really key to what we do within IRS because it provides us with a means to train people. So the training of our staff is important, and they do that through a research and development program. But the outcomes of those research and development programs lead into innovation and improvements of service within the NHS as well. And I'm going to mention a couple of those as we go along. Okay. I'm not going to talk about the traditional forms of providing medical physics support within the NHS, which is testing X-ray equipment, but some of the innovative things that we've been able to do over a number of years. And I was interested to pick up an earlier comment. That's why I brought these up. I was making some notes from some of the previous speakers. There's earlier comments, it might have been John Warrington said, about IT as an add-on within the NHS. If you're doing anything that involves IT, NHS IT departments tend to throw their hands up in the air a bit and get a bit wobbly and a bit funny. And particularly if you're involved in diagnostic radiology. Because diagnostic radiology, the moving of image data around, is probably the biggest impact on IT resource within the NHS, as we feel. So things like providing software support to allow diagnostic radiology to carry out quality control and quality assurance. We have an application called Quadris, which we use to assess the radiation dose delivered to patients and to monitor the quality assurance that goes on within the radiology department. So we provide that to the organisation, to radiology, and they manage that data, obviously with us overseeing and providing support to that. So that's well established within our NHS trusts and provides technical support. But importantly, it's part of our development programme and it's available to our NHS organisations as part of our service provision. So there's no additional cost burden, if you like, for that aspect of service. And other QA tools for mammography. We work quite closely within the NHS breast screening programme, both as local service provider, but also as coordinators of medical physics on the national group as well. And that leads us on to things like dedicated software applications to managed radiation protection documentation within the NHS. And we have this suite of quality tools which we call Radialis for document management and data management. And that all goes on. It's a cost-effective, time-saving, and more importantly, it optimises the resources within the radiology department because it means that radiographers and clinicians can put time back into managing their patients as well. Okay, future IT developments that we're looking at, because I think IT and providing a different way of giving medical physics support to the NHS is important. So web hosting of documentation, effectively acting as the repository of local documentation for local NHS trusts, reports on equipment testing, correspondence with regulators or with your professional consultants as well. Elements of being able to benchmark the performance of your organisation against similar organisations for which IRS provide those services. So that list of 20 NHS organisations, so you can benchmark yourself against those individuals as well. I've mentioned R&D. We have a well-established R&D programme. As I said, I think the biggest change of technology in the NHS was the move from wet processing to digital imaging technology. Developments of CT technology, direct digital radiography, computer radiography, and so on and so forth. So that R&D programme, which we've been instrumental in developing, has kept those NHS organisations at the forefront of being able to apply that technology optimally to the treatment of their patients. Also, as part of our R&D process, we actually provide a funding direct into the NHS through this organisation called CORIPS, and that's the College of Radiology Industry Partnership Scheme, and we believe we're the only radiation protection service and medical physics support service that actually is involved in directly applying funding back into the NHS to allow them to do research and development. And it's real-world R&D as well. It's not blue sky thinking R&D. It's the outcomes of research and development programs have a practical implementation on improvement of healthcare. Okay, so a little bit about some of the aspects of R&D and innovation that we've been involved with, both from a professional consultancy point of view, right through training and through business management, our internal management processes, all has an impact on clinical practice, on being able to improve and make you be more efficient in providing the clinical service of diagnostic radiology to those patients. Our other advantage of being central in the service provision that we provide into NHS is that we also provide a relationship, a buffer, if you like, between the big ticket equipment manufacturers. So we have partnership working with the likes of Siemens, Philips, Fuji. You can see the names up here. both the big ticket equipment manufacturers, so those people who are supplying you with CT and MR and biplane cath labs, but also with the professional standards organisations. I've already mentioned the College of Radiographers and their industry partnership scheme, but also the Institute of Physics and Engineering in Medicine, which is the scientific, if you like, support body for medical physics within the NHS. So it's all about improving efficiency in clinical practice from the services that we provide in. Say a little bit about relationship management and where we feel this fits in. These figures up here, just some of the hard items of information that we provide to our NHS organisations. Over 3,000 examples of individual requests for radiation safety advice. Over 1,000 on-site tests of X-ray equipment, for example. It's all got to be managed, and part of our relationship management process is to do that through really a bespoke management information system that we've put together with an ISO 9000 and Ticket Plus accredited organisation. On the back of those accreditations, we're also a silver level Investor in People Award, having just been rewarded with that. And of course, the important part of relationship management is about communication. We've already heard aspects of that today. So we provide a service where there's a radiation protection advisor always available to an NHS organisation if they need some advice. We have named site or project managers. So there'll be somebody, a central point of contact for each of our organisations to come to for information and build that relationship up. Of course, the usual formats, newsletters, bulletins, attending committees, the dreaded Twitter and Facebook, if I can use those expressions, I don't do that myself. But also things like software suites of Radialis. Although this is at the bottom of the slide, it's quite an importance in terms of relationship management. Being able to liaise with regulators on behalf of the NHS organisation, or at least be there to hold a hand. Because when the inspector comes calling, if any of you have been on the sharp end of a CQC inspection, for example, you know it can be quite a daunting process. So, just to wind up, as I say, the outcomes of our innovative approach to providing radiation protection and medical physics support services have led us to, we feel, be able to deliver a quality service. It's presented as part of our added value in service provision to the NHS, and that's always an important part of the procurement process, we find. We're open and transparent. Again, we've heard references to a lack of transparency, needing more than transparency. IRS's processes are always open and transparent. We learn and develop with our NHS partners, our NHS organisations. The transfer to digital imaging technology was a massive step change in providing medical imaging within the NHS. It was a steep learning curve, not just for the radiology departments, but also for physics support services as well. So we were able to learn along with them and at least stay on the same page, if not be too far ahead of the game. So it's a good learning process for everybody. So it's an investment for us in our long-term customer relationship process, and it gives us some highly motivated and committed staff to be able to provide the service that we do. One other thing I probably should mention right at the end, we've also heard about the level playing field. And I said right at the start, we're the largest independent provider of medical physics support services. In some NHS organisations, these support services are provided in-house, but they still go out to procurement and out to tender for those services. So it's a matter of, again, from our point of view, being able to see that level playing field where effectively we're competing with an internal organisation. And that's always a bit of a difficult task for us to manage and to get our heads around. Okay, so really, I'm just winding up. Our relationship management process, we see it again, is all part of our quality management service, our quality managed processes and services that we provide into the NHS, both from our professional consultancy, from our scientific and technical support services, R&D, business management and training. And that is the last slide. That's a nutshell in IRS. Give you some examples of the innovative approaches to providing medical physics support. And this is actually a direct endorsement from one of our clients as well. Cost-effective radiation protection service of choice. So it's not just me saying that up here. That's one of you guys. I'm not sure actually whether the organisation is here represented today, but it's one of the RNHS organisations. So thanks for the opportunity to tell you a bit about us and what we're doing. Thank you.